और हॉस्पिटल्स जो हैं वो मतलब प्रोवाइड कर रहे हैं फैसिलिटी। आउटपुट है ना कि वो रेडी हैं किसी भी हेल्थ केयर फैसिलिटी के लिए। हॉस्पिटल्स आर क्या कहेंगे, जो मैप किया आपने हॉस्पिटल वो आपको फैसिलिटेशन प्रोवाइड करेंगे, सर्विसेज है ना। हॉस्पिटल्स शॉर्टलिस्टेड कह लें या मैप्ड कह लें, थोड़ा सा ये उससे डुप्लीकेट हो जाएगा, वही चीज़ यहाँ पे आ जाएगी। आउटकम में ये है कि हॉस्पिटल्स में आपको हेल्थ केयर की फैसिलिटी मिलना शुरू हो गई है। हेल्थ केयर फैसिलिटेशन
ये वो बता रहे थे आउटकम क्या है, सेटिस्फेक्शन वो इसमें आएगा।
अब सेटिस्फेक्शन ये है ना कि एक बंदा
सेटिस्फाइड है इस सिस्टम से,
ठीक है, वो भी आप डाल दें। जब वो हेल्थ केयर फैसिलिटीज उनको मिलना शुरू हो गई तो वो सेटिस्फाई हो गए ना। ये आप अलग से अगर लिखना चाहते हैं तो अलग से लिखते हैं, हेल्थ केयर फैसिलिटेशन इन हॉस्पिटल्स, वो आप मिल गए। और इम्पैक्ट आपका ये क्या है कि आउट ऑफ पॉकेट वो आपका रिड्यूस हो गया। लाइफस्टाइल को उन्होंने कहा था कि वो आप इसको ना रखें, ये चूंकि बहुत ही लॉन्ग टर्म में जाती है। तो हमारा जो क्वेश्चन है वो क्वेश्चन यहाँ पे टारगेट हो रहा है इम्पैक्ट में कि आउट ऑफ पॉकेट एक्सपेंडिचर है, वो कंट्रोल हो गया। वो तो एक पहला पायलट प्रोजेक्ट है ना। पायलट प्रोजेक्ट तो आपके एक छोटे लेवल पे होता है, उसको आपने स्केल अप करना है। फॉर एग्जांपल ये आपने एक डिस्ट्रिक्ट में किया, इसकी बेस पे करना है। हाँ, वो रिजल्ट्स आपको बता रहे हैं ना, रिजल्ट कह रहे थे, रिजल्ट्स पे। अब आप अपने 3 जो क्वेश्चन है नीचे वाले उन पे हाउ कॉन्फिडेंट वुड यू बी इन proposing a scale up of this product, यही क्वेश्चन जो अभी हम बात कर रहे हैं, ये 100% सिग्निफिकेंट है। सारा कुछ आपका रिजल्ट्स दिखा रहे हैं कि आप इसमें स्केल अप कर सकते हैं। वो अगर आपने एक डिस्ट्रिक्ट में किया था या किसी मखसूस एरिया में किया था तो अब उसको आप स्केल अप कर सकते हैं। स्केलिंग अप का मतलब ये है ना जनरलाइजेशन, वो इसका मतलब ये आपको। अच्छा, which challenges do you observe and how would you counter them? ये वो टेक्निकल सा क्वेश्चन है। आप which challenges do you observe?
क्वालिटी एक चैलेंज बनता है, क्वालिटी ऑफ हेल्थ केयर सर्विस कैसी है वो उसका कोई नहीं है।
क्वालिटी को हम मेजर नहीं कर सकते, ये अच्छा पॉइंट। दूसरा ये भी हो सकता है कि कोई पेंडेमिक आ जाए, कोई आउटब्रेक हो जाए, कोई डिजास्टर आ जाए, आउट ऑफ कंट्रोल है ना कुछ डिजास्टर आ गया ना, क्लाइमेट चेंज का, उसकी वजह से सैलाब आ गया, तो उस सूरत हाल में भी आपका ये सारा सिस्टम बैठ सकता है। आपको फाइनेंशियल क्रंच आ सकता है, पहले आप इशू ढूंढे ना, मॉनिटरिंग कैसे करें, वो इशू बाद में उसको काउंट के लिए सोचते हैं।
मॉनिटरिंग करनी बड़ी मुश्किल है किसी को प्राइवेट हॉस्पिटल।
हम पहले प्रॉब्लम ढूंढते हैं। एक प्रॉब्लम ये कि क्या उसको कहते हैं, एक्सटेंसिव मॉनिटरिंग कहते हैं, 100% आप मॉनिटर कर रहे हैं। अब आपके पास 4 इश्यूज आ गए। एक क्वालिटी हेल्थ केयर, उसकी प्रोविजन मुश्किल है, ये चैलेंज है। दूसरा आपने चैलेंज क्या लिखा था सर?
मॉनिटरिंग क्वालिटी ऑफ हेल्थ।
उसके बाद एक और
वो है कि वो प्राइवेट हॉस्पिटल तो आपके कंट्रोल में नहीं होते, वो इंडिपेंडेंट,
तो क्वालिटी में आ जाएंगे ना, इंसानियत नहीं है लोगों की, अलग से
क्वालिटी एश्योरेंस, मॉनिटरिंग ऑफ दी क्वालिटी,
मॉनिटरिंग को अलग रखें। और एक वो क्लाइमेट का हम डाल दें, अगर क्लाइमेट इम्पैक्ट, अगर कोई भी इशू डिजास्टर क्या कहते हैं, या कोई आउटब्रेक हो गई,
बियॉन्ड कंट्रोल है,
चैलेंज नहीं हो सकते। वो क्या मतलब उसको हम वो चैलेंज देखें जिनको हम टैकल कर सकते हैं। क्वालिटी को हम टैकल कर सकते हैं चैलेंज इस तरह के, उसमें आप एक्सटेंसिव मॉनिटरिंग का फैक्टर डाल दें,
कोऑर्डिनेटेड ये मैकेनिज्म, कोऑर्डिनेटेड एट मॉनिटर,
और इसको वो होना चाहिए, फर्दर वो होनी चाहिए, वो आगे लोग
कंप्लेंट मैकेनिज्म,
रिड्रेस, वो उसको क्या कहते हैं,
redressal
grievances redressal mechanism.
फैसिलिटीज हम दे रहे हैं थ्रू पब्लिक सेक्टर के हॉस्पिटल्स देंगे या प्राइवेट
वो
सेक्टर
हमने दोनों को लिखा था, दोनों को लिखा था, मैपिंग हॉस्पिटल पब्लिक एंड प्राइवेट। बस प्राइवेट होते हैं जो जरा अच्छे वो प्रोवाइड करते हैं
सर्विसेज,
तो दोनों में आता है। ये अच्छा ग्रीवेंस redressal mechanism है।
कम्युनिटी बेस्ड मॉनिटरिंग भी डाल देते खुद भी देखते रहे अपने इलाके में अपने गांव में अच्छा सर ये आउटपुट मेरा क्लियर नहीं है आउटपुट आपने क्या लिखा
आउटपुट सिंपल सी बात है ना, ये एक प्रोजेक्ट था कि इसको यूज करके मैं अपनी बात कन्वे करूँ, बात कन्वे होना इम्पैक्ट नहीं, लेकिन इसका यहाँ पे आ जाना आउटपुट क्या
अब हॉस्पिटल नेटवर्क है तो उन्होंने सर्विस डिलीवरी शुरू कर दी
हाँ
प्रोविजन ऑफ हेल्थ केयर सर्विसेज प्रोविजन ऑफ
नहीं, वो प्रोविजन आउटकम में आएगी।
आउटकम तो
आउटकम आउटकम
आउटकम करिए कि थोड़ा बड़े लेवल पे ले
पहले तो ये कर दें।
प्रोविजन ऑफ हेल्थ केयर सर्विसेज सब्सिडाइज्ड हेल्थ केयर
ठीक है, ठीक है,
ये टीचर नहीं है इसका
आउटकम ये हो जाएगा कि पीपल आर सेटिस्फाइड है, सेटिस्फाइड विद हेल्थ सर्विस है, हेल्थ केयर सर्विस। और आउटकम इम्पैक्ट में ये है कि आउट ऑफ पॉकेट वो आपकी रिड्यूस हो गए हैं, वो समवेयर आप बताएं। मेरे सामने तो मॉडल पूरा हो जाता
बन गया मैंने लिखा कि डेथ रेट कम हो गया वो इम्पैक्ट में ओवरऑल वो वाइटल स्टैटिस्टिक्स है मोर्टेलिटी रेट छोटे बच्चों का वो कम हो गया एक्सपेंडिचर रिड्यूस हो गया ये चीजें कोई और है
लाइफ एक्सपेक्टेंसी कहते हैं क्या कहते हैं
लाइफ
है। इसमें आपका ये भी आ सकता है कि आप जब वो वर्किंग आवर उसके बढ़ गए, पहले लोग बीमार ज्यादा रहते थे, बच्चे अब स्कूल ज्यादा जाना शुरू हो गए,
बिल्कुल ये भी आ सकता है ना, मतलब वो वहाँ से कटेल हुआ है एक्सपेंडिचर तो वो किसी और उसमें एजुकेशन या किसी
अटेंडेंस इन स्कूल
work hours increase, attendance increase, schools increase, जो आप बात कर रहे हैं जो सेविंग है वो आप डाइवर्ट हो सकती है,
सेविंग बढ़ गई सर
वो कहीं और आप डाइवर्ट कर सकते हैं। और अल्टीमेट जो टारगेट आपका है, टारगेट तो नहीं है, वो एक अल्टीमेट सुपर किस्म का इम्पैक्ट है, आपका लाइफस्टाइल बढ़ गया, बेहतर हो गया, लाइवलीहुड बढ़ गई है। क्या स्टैंडर्ड ऑफ लिविंग, लाइफस्टाइल, वो सारी यानी ओवरऑल सोशल प्रोटेक्शन आपने अचीव कर ली।
ये चैलेंज
आखिरी क्वेश्चन जरा थोड़ा सा, मैं तो सारा मॉडल बना दिया, डिफरेंट क्या करेंगे।
डिफरेंटली क्या
मतलब इसका डिफरेंटली क्या हो सकता है?
आउटकम एक ही होता है सर
आउटकम एक ही होता है बेसिकली, मल्टीपल भी ले सकते हैं क्योंकि इम्पैक्ट भी आपने अक्सर
इम्पैक्ट तो आ गया
उन्होंने ये लिखा हो ना, एटलीस्ट वन हो जाती है। जो आर्मी बनता है वो ऐसा होता है कि हर एक्टिविटी जो है ना
Okay, I would propose that all groups are winding up in the next minute and then we'll join the plenary again.
You were in charge of this ministry, what would you have done differently?
ये किया कोऑर्डिनेटर
ये चीज हम उसमें चैलेंजेस को हमें अलग करना है, ठीक है।
मैं असल में एक प्रैक्टिकल केस में चला गया। अभी इनको बताया 7 साल की बच्ची के साथ जाती स्कूल के प्रिंसिपल 4 साल प्राइवेट स्कूल है, रजिस्टर्ड भी नहीं है।
Sir, you come. Sir, Sundar.
Okay, everyone. Time to finish. You know, I'm German, right? So Germans are always very strict about time. Okay, let's join the plenary and then we'll share the results. And we would also ask for one group to volunteer. I saw that this group was working also electronically. I don't know whether you have put it together also electronically. So for the first exercise, if we can have one group to volunteer to present their case and then the others can chip in. Yeah, perfect. Yeah, over there. No, I mean, I'm trying to get. Can we all move back to the plenary, please? Thank you. And just for the first exercise, okay. Yeah, great. You want to use this? Okay, so I'm handing over to our group who's volunteering. And it would be nice if you can present the inputs and then we can pause just to see whether everyone is on the same page. And then we go to activities, outputs, outcome, and impact.
Thank you very much for giving opportunity to present this thing. As you know, you have gone through this program descriptions and all the other things. You people already know about a lot about it. Actually, we have worked on the input activities and outputs and outcomes based upon some assumptions. For example, we have assumed that the idea on theoretical level has been matured and the infrastructure is ready. And now we just have to implement the idea in the form of a pilot project. So that's why we have not included that things like idea is being conceived, surveys is being done, or we have to do and this thing we have to hire people. So we have not been included all these things in the inputs. We have from on these assumptions, we have started that our input is the introduction of health subsidy to reduce the out-of-pocket expenses of people for health, right? So this is our input, one single input on the basis of all these assumptions. And the activity after this, we have that is the awareness campaign so that more and more people know about that this subsidy is available in these 100 districts so that they get enrollment for these things. And as a result of this awareness campaign, the output is this, that a lot of people in the amount is written here has did enrollment on the basis of this awareness. And after enrollment, we did also a study to see the outcome of this enrollment and this intervention. That is the outcome, that is reduction in out of pocket expenses for the health. It means that we have did study before the introduction of this intervention, and now after the introduction of this intervention, we collect the data and we come to the conclusion, that is the outcome. And the impact of this intervention is that there is improvement in the health of people. Mortality rate has gone down. Health also has improved. The people who have saved money from the expenditure of health insurance, they have used that money for giving better food to their kids. So their health has improved in this sense also. And they are using that money also to send the peoples to send their kids to school. And last and not the least, when you have some more money, then there are less fights in the home. This is the biggest impact. And the next thing, the questions there is written here, because we have introduced this intervention on the basis of our scientific study. We have did pre-testing, we have did post-testing of the pilot after the introduction of the pilot project. So we are 110% confident to propose the scaling up of this project. Second one.
Okay, wait, let's just pause here. I think it's great. I mean, also for letting us already know that you're pretty confident, but let's also see what other groups answered with respect to question 1, just to have some discussion. But
Sure.
yeah, because otherwise I think we will not remember all the details. I'm sure that there are other groups who solved this exercise differently. So do we have anyone who would volunteer to just outline, you know, what the differences are, or maybe also whether you agree with the results chain that was presented by the first group? Or you want to present yours as well, or?
We have took this differently. The task, this frame is like inputs. In inputs, we have done like number of families enrolled. This is the input of our valuation, this strategy, and then number of pharmacies registered. This should be the input from our perspective. And then we are talking about activities, registration process, and number of enrollment centers. So we try to do this, that our indicator should be measurable. So we incorporated according to that. And output of this log frame should be number of treatment provided, like number of beneficiaries we provided treatment, and number of pharmacies on board. These are the outputs. And then we're talking about outcome, which is effective utilization of having limited resources. Effective utilizations of, because these people have limited resources. So when they are not spending money on healthcare services, they are spending money on education or getting some nutritious food. So this could be the outcome. And lastly, we talked about the impact improvement in socioeconomic status of household, because they are not spending money, or they have limited money and not spending on healthcare services. Then they're providing their children education or getting food for them, then their socioeconomic status would be better. This is the answers of our first question, and there are some second question as
Yeah,
well.
I would actually also, again,
Okay.
before we get to the confidence levels in this group, I would also stick with, and it would be nice
Okay.
if you can actually move up again, because then we look at it, and also we still have the first example in mind. So let's look at those two examples and just see whether anyone has any questions or comments. I mean, you've all gone through the exercise. Any feedback? Yeah.
So I personally believe that because the program was a pilot initiated on pilot basis, and we are going to roll it out to on the national level. So for the existing 100 villages, maybe it will work because we do not need national level resources for it. But I'll give it a second thought before launching it on national level, because we need more resources and obviously more data.
Okay. Yeah.
But they have
I think this
resources,
is-
I think so, because they are doing pilot. This was the pilot one, and they want to extend it, so they have resources, I think so.
I think here we need to differentiate whether, sort of at what level we're taking a decision and what we're talking about. I think your comment actually applies more to question 2, also
Yeah.
when it comes to the decision, should we now scale up? This is actually not the basis for our evaluation. This will help us get us the results in order to actually take a decision. And then, of course, resources are another important factor to consider. Let's maybe look at this results chain and also think about the first one. I mean, the first thing I want to say is that also for other groups who have now a different sequence, where you place activities as such can be to some extent, or not activities, but the indicators can to some extent be variable, but they all need to be properly sequenced and built on each other. So for you to know in the end, what is the entire purpose here? I mean, you want to use these indicators in order to essentially determine, are we going to scale up or not? So first of all, first important thing is that your outcome, or essentially your outcome, also needs to respond in some way to the objective of your intervention, right? And so the health insurance subsidy program has something to do with, of course, out of pocket expenditure or health service utilization, etc. So we would expect indicators in this area. Yeah, I mean, so that the outcome is aligned with the objective of the intervention. Like where you put outcome, or first outcome, secondary, tertiary, or immediate and long-term, or short-term, medium-term, long-term, etc. That is to some extent, of course, also variable, right? This depends a bit how you've structured your results chain. And here, of course, I second also your statement. You said, we've done certain things, so it also depends how mature, of course, the program is where you start. Still, inputs are inputs, yeah? So you want essentially to know whether you're reaching your objective, and that's what you measure by outcome and impacts. And you want to know whether on the way something is actually going wrong. That helps you explain why possibly you might actually not be reaching your objective, because that's essential to know. And that's why it's also not trivial. Of course, you can say inputs, yeah, we know that we need money and we know that we need people, etc. But it's important to think through for your intervention, how much do you actually need in terms of resources? How much staff? And if you know that for this, I don't know, entire program, you would have needed 1,000 people, and you monitor and you discover that only 200 people on the ground are doing the intervention, this of course can endanger your activities, affect your outcomes, and then essentially your impact as well. And this is something you want to keep track of, because essentially you want to test the idea, right? And not only the implementation. So if you're giving someone half of a vaccine or a quarter of a vaccine, you know, later on you cannot argue, okay, the vaccine doesn't have an effect. Yeah, it's how you've actually presented it or implemented it. And that's why it's important to actually keep track of what are we doing, how much are we putting in, is that sufficient for the activities? Did we actually do the activities as planned? Did they lead to the outputs? You know, were all the health centers on board or not? How many people took it up, etc. So you can actually track progress, and in the end, you know, okay, the result, everything went more or less okay, and the result is really the result of the intervention that you've actually put in place. So in terms of inputs, I mean, here, for instance, just to show you what I meant by sequencing, you have as an activity the number of enrollment centers or registration process. So naturally, you would think that the families enroll afterwards, right? So it needs to be sort of a step at a time. And so this is something that you have to keep in mind, because you want to see whether one thing leads to the next. That's a bit the entire idea behind this chain. So inputs typically, so, and as I said, across all interventions is the resources that you put in, whether financial, human resources, the infrastructure, whatsoever, everything that you need in order to actually perform your activities. And it's not to test your understanding whether you know that you need people and money, but for you to keep track whether you have the necessary resources, the good number of people, etc. And then I think for your activities, outputs, outcome, that actually sort of was a nice follow-up. You know, it was nicely enchained. You could see, okay, are the activities actually leads to the outputs, then to the outcome and to the impact. And you also reflected that the outcome, you know, is related to the type of activity that is planned. Of course, I mean, you could also have a step in between that you say, I know that some groups discussed, you can here have the registration process, the sensitization process, whatsoever. And then as a next level, you could also look at how many people were registered, because you also need to monitor your activities in a way. So if you just put the activities, you also want to have an indicator of, you know, whether this actually takes place or not. So you could have, instead of, I think you had the number of people enrolled. So as an intermediary step, you could have the number of people sensitized, yeah, the number of people enrolled, and then the number of people who visited the healthcare centers as the next step, yeah, because you also don't go from getting your card to out-of-pocket expenditure being reduced. There are also some steps in between. So yeah, this could be outcome, you know, at different levels, so to say. You can also call, I think you called it final outcome in terms of the impact. So here, the question is just that it's sort of a logical chain of events, yeah, that you want to sort of see one after the other. Okay, that's
this overall outcome of the program, overall outcome. This is the you are talking about a single activity and the outcome of that activity within the program.
The further you get, the higher aggregated, of course, your outcomes are. And it's not just in relation to one activity, okay, but in relation to the combination of activities that you've actually put in place. Yeah. I mean, we were just now working with examples. Yeah. And I'm not saying that this is wrong. This is, of course, something that we're interested in, but I would have an outcome related to healthcare expenditure, particularly health, also somewhere on the way. Yeah, so for me, this would be actually further down the line. But I mean, this is right. This is even further. But I would want to insert something that directly corresponds to the intervention that we're putting in place, and it's about healthcare subsidy. So I would want this to be reflected somewhere.
Okay.
Yeah. So it's not all. I'm not saying that this is all wrong, but it's just that I would build in some steps. I would move this actually further down so that it sort of logically follows.
Okay.
Yeah.
That's fine.
Any further questions or comments? Because then I think we'll move actually to how confident you are. And we already heard that you are more than 100% confident. I'm interested in seeing whether other people are also as confident. I hope not, but do you want to continue as well? I don't know for your group, whether you're confident or not, but just for the second question. There's positive impact because more than 50%. Okay, so you're also confident. What about the other groups? Yeah.
50% of the population from the baseline sample is enrolled, so keeping in the view, we are confident that 50% is okay.
Okay. All right.
It
So yeah, I can understand this. So you're
It
saying
depends.
yeah.
It depends the success rate. If you take like 50% or 30% or 40%, what have you set the the objective? How many people should be enrolled and get benefit? That's the reason. But
Okay.
50% is okay.
And that's actually a great word to say. It depends on the objective. So
Yeah.
again, what is the objective of our intervention? Is it to enroll people or is it to reduce healthcare expenditure? That needs to be reflected in your table, and that also helps you to determine if it's to enroll people. I would completely buy your case.
Okay.
Then I think it's a different story. How about the other groups? How confident are you? That's true.
Yeah.
So everyone is confident. The ladies, are you confident? Yes? Okay.
Confident, the relationship between the two variables, dependent and independent, is quite significant. And almost relationship is showing 39%, and significance level is about 99%.
Mhm.
So definitely we would go for it.
Okay. Okay. Should I hand over to the person who was actually presenting the answer to this question earlier? Okay, what did you learn earlier in the session when it comes to impact evaluations? What is one of the core principles? What do we need to worry about?
Effect size.
Well, effect size when it comes to the sample size, that plays a role. And of course, generally we need to worry about the effect size as well. But if we want to really do a solid, robust impact evaluation, because deciding on whether this program is going to be rolled out or stopped is a pretty important one, right? So what do we need in order to make that decision? We need people to be enrolled, that's true. But what do we need, like, for that comparison? Do we need a baseline? So that's something we have. So baseline and end line. Okay, but what else would we need in order to? Yeah, control group. So where's our control group in this example? Yeah, exactly. So that already reduces our confidence level, or it should, because we learned that otherwise we cannot attribute the effect to the intervention. At least, yeah, I mean, it's not possible. It might be, but we still run the risk that there are other effects that happened in the meantime, right? There might have been actually other healthcare measures that were implemented that also had an effect, on people's out-of-pocket expenditure. You want to? Okay, sure. Yeah. And the group is
we are going to.
Okay.
Yeah. Okay. So in my group, I'm representing almost 6, 7 very active female group. So in our group, we analyzed that inputs are available, budgets are available, so and human resource is available. So when we are going in activities, so we are hiring the firm and to conduct a household survey in 100 villages, and then it's another activity is analysis of data. So in outputs, we have a survey report, and The another impact is that our expenditure was basically before the initiative, the expenditure was $14.49 US per household. So in output, we saw that after intervention, we saw that there is a considerable decrease, and that's 45% decrease in out-of-pocket expenditure. And in this, we have an impact. We saw that there are number of number of children going to school, workers, number of workers are present in the factories. So this is some overall impact, and the expenditure also reduced by 45%. So our analysis is that the project is viable and this could be replicated at the national level.
Voice of confidence. Just to say, I mean, that's why we're arguing. I mean, we can understand that this sounds tempting and the numbers all look fine and all right. But as I mentioned earlier, I mean, we learned, right, today that we cannot be 100% certain. I mean, it could be other interventions. It could be a shock that affected the region. It could be other things that were going on at the same time that could have had an effect on people's health expenditure. And so we can actually not be confident that the results that we're seeing, which are indeed positive, so this is something you interpreted correctly, are due to the intervention. So making a decision here on whether to pull the plug or whether to continue is actually, we cannot do this on the basis of the data that we have. I see some people confused.
How can we do that?
Yeah, that actually is question number 4. So first of all, did you see any other challenges? I mean, I presented now one challenge. We don't have a control group and this is a challenge. Yeah. Did you spot any other challenges in the evaluation? Then we get to the answer of what we could do. Yeah, so I mean, and that also sort of highlights again the need for the control group. Indeed, yeah. So if in parallel other interventions were started that also have an effect on the outcome that we're interested in, right? This could be, I mean, not in this case, but it could be a pandemic that happened, right? That has an effect on healthcare expenditure. This could be also a positive shock in terms of a new program that is put in place. This could be new healthcare facilities in the villages that we're talking about, whatever. This could be a provincial initiative complementing the national initiative, you know, you name it. Any other challenges that you saw? Well, generally, I mean, if you look at the scenario, is there anything, when we're now thinking about an evaluation, is there anything that you think could be problematic?
चैलेंजेस के हवाले से था कि अभी हमने कंट्रोल ग्रुप की बात की है। अब एक अभी हम डिस्कस भी कर रहे थे कि जिस पॉपुलेशन में से हम सैंपल लेते हैं उस सैंपल पे तो हम एग्जीक्यूशन कर रहे हैं, जो पॉपुलेशन का बाकी एरिया है क्या वो कंट्रोल ग्रुप के जुमरे में नहीं आएगा?
So the answer is yes and no, both. कंट्रोल में भी आएगा, कंट्रोल में नहीं भी आ सकता है। पॉपुलेशन के अंदर बहुत सारे ऐसे होंगे, हाउस होल्ड होंगे जिनके कैरेक्टरिस्टिक्स मैच नहीं कर रहे हैं सैंपल साइज जो आपने सिलेक्ट किया उसके साथ, और हो सकता है कि हों भी। So that's an open question. So actually the question was that we can also consider the rest of the population as a control. So my response to that is, yeah, you can do it, but you can also not do that. Maybe the rest of the population is not similar to what you have, selected the sample. So they may differ as well. So, but yeah, there's also the worry that's related to what we call the external validity, right? So to what extent that sample we have selected here, or the sample not we have selected, but enrolled in the program, is representative to the rest of the population and depends on how big is the population, the rest. That's also important.
But I think you're getting to the solutions because, of course, identifying or seeing whether we find a control group, and this doesn't have to be one that is randomly drawn from the beginning, but it could also be that we think about, comparable group at hindsight is still a strategy. So it's it can never be as perfect as a randomly drawn sample, but still, I think it's a good thought. So it's not that we are stuck in the situation we cannot do anything, but we would have to at least consider that it's important to actually look at a control group. Okay, there are some, let's say, smaller challenges also hidden in this scenario. I don't know, I mean, who is doing this evaluation? Did anyone notice?
A group of ministry. The other
The same
department-
ministry, okay. Is that a good
Bias.
idea? No, I see some people shaking their head. Yeah, so of course, why might this be a concern?
Yeah,
Yeah.
there must be some third party who can do that.
Exactly. I mean, of course, it's still possible for a ministry to do an unbiased evaluation, but later on, when you sell it or when you want to market it, then of course it always has this image that it was actually biased or someone cooked it up. And of course, data can to some extent also be manipulated. Let's be open about this. And so it's always important, of course, that an external agency is going to do the impact evaluation. What about the costs? I got the translation that some people were also concerned about this. You said it's too high. Yeah, so I mean, 20%, we also would have to think carefully, even though we really like impact evaluations and we believe that they're also going to deliver important results, we might also put into question whether 20% is really not indeed too high. Yeah. And then there was also a piece of information that there is actually a systematic literature review. So there seem to be quite a number of studies already on the topic. So if we have already quite a number of impact evaluations, again, we would have to see, are they from a relevant region? Is this comparable to the intervention that we have planned? But generally, if there are already 100 impact evaluations on health insurance subsidy programs, possibly also from the region, then we might want to ask whether we really need another one that is going to eat up 20% of our program budget. So if they're all positive and all, sort of confirming that this has an impact, then we might not want to spend actually this money, but also see how this can be then implemented in the context that we're thinking about. So this is again another thought that we should at least the opportunity cost, because of course we could also have, instead of 100 rural villages, we might actually have 150 rural villages that we could have reached with the same budget already. So again, we need to sort of compare the money that we need to put in and also the value. If it's an entirely new intervention or if it's only been tested in, I don't know, Africa, and you say, well, Pakistan is a completely different context and this has no relevance for us, then of course it's a different story. But also think about that. Yeah, not every intervention needs an impact evaluation. Do we have anything else we want to problematize? Maybe the number of people that were enrolled? I know that there was some excitement that this is actually positive and, we reached out to a good number of people, but for our impact evaluation, even if we had a control group or if we were to identify a suitable control group later on, the fact that only a certain percentage of the people we wanted to target enrolled can also be problematic. Can anyone think of why?
When the government tried to give,
Yeah.
here Pakistani have very different psychology. When government is trying to give some free medicines to people, then they always have the fear that this medicine has a substance. After taking this medicine, they would not be able to give birth to child. So this will be the biggest challenge for enrollment. So we have to create confidence in the people that if they will avail this subsidy, health subsidy, then there should not be something like this. We have seen this during the time of COVID when government was giving free vaccines to people. People were not ready for that vaccine because of this fever, that we will die after 2 years, or we would not be able to give birth to kids. The government is doing something wrong with us. So this is the biggest challenge in the enrollment. So we have to create confidence in the people that there is nothing like this in this free subsidy related to health.
Okay, yeah, so that could be definitely a challenge we need to look out for when we're actually sort of in operational mode and trying to put this intervention into place. But let's also think about it from an evaluation perspective. I don't know whether you wanted to talk about this. Yeah.
What we have observed in the study, that the expenditure is reducing, but we are not discussing the quality of health services to be provided. So for that purpose, we have to decide whether we are going for quantitative study or qualitative study. For the in-depth analysis, I think we have to go for qualitative analysis.
Again, I think there are two elements. I mean, we can, of course, also, let's say, capture qualitative aspects through quantitative indicators. But I think it's a good point, of course, that we should not concentrate on one outcome by itself. So that could, again, also be another challenge when we're trying to assess it. Let's say the last point I wanted to touch upon in terms of the enrollment rate. I mean, we heard that maybe some people are scared, or there are certain people who will only go for this, right? So when we later on draw inferences about this and actually say, you know, this is actually something that is going to work for the rest of the population, we need to be mindful that the impact evaluation only attracted a certain type of people, and that also the results we produced might be, again, related to this. If we're only reaching out to those who are anyhow very motivated and able and etc., then the effects might actually be overestimated for the rest of the population, because those who would not go, who would be particularly concerned, etc., they're actually not showing up in the first place. So if we're doing that intervention on a national scale, our results would actually not be as high if we had a control group. I don't know whether this is clear. It could also be in the other way, the other way around. So here the concern is that we're not reaching to a representative group of the population, but we're only reaching to a certain subgroup because we allowed them to enroll. It's not that we selected them for the study and we said you are treatment and you are control, but they were able to actually self-select themselves into the study. And so then we could actually, yeah, only reach a subgroup.
Within the health sector programs or health insurance program, there could be a selection bias in enrollment, in a sense that those who require the treatment, they only choose to get enrolled in the program. That effectively increases the cost as well. So if you have a sample of 4,000 and the enrollment is 2,000, the 2,000 may be only those that require the immediate treatment rather than those requiring at the later stage.
Yeah, so I mean, that's the same bias, of course, that we're talking about also for the evaluation study. It's a selection bias. So yeah, absolutely right. And so this is something, again, we have to keep in mind. Maybe a bit more technical, but I hope you could sort of at least get a picture of what to watch out for in terms of an impact evaluation. And now maybe for the solutions, I can hand over to you again. And then this is a sort of a nice transition into the next presentation, because I realize we've taken up a lot more time.